Hi everyone, I'm a neurologist, and today we are going to talk about multiple sclerosis. We're going to talk about the symptoms, how it's diagnosed, what are some of the treatment options, and much more. So stay tuned. Multiple sclerosis happens when your immune system attacks the protective covering around your nerves, and this can cause a lot of different problems. So let's break down kind of how this happens and how it affects your brain and body. So here is the brain, and here is the spinal cord, and in between each one of these, we have these little gaps. And here you can see the nerves kind of coming out of the spinal cord. Each one of these nerves is covered by a myelin sheath, and that myelin sheath acts as a protective covering. It helps with signal transmission, and it also helps the signal go faster. In multiple sclerosis, we have inflammation and damage to that myelin. And so what happens is when we have inflammation and damage to that myelin, it causes the signal to slow down or stop. When the signal stops or slows down, it can cause all sorts of problems with your vision, with your balance, with your coordination, with your strength, and even with your bladder function. So there are lots of different symptoms that can occur with multiple sclerosis. Some people might have visual problems. They might have double vision, or they might see spots. Some people have numbness or tingling. They might have weakness in their arms or legs. They might have problems with balance or coordination. They might have dizziness or vertigo. And some people even have cognitive issues. They have problems with memory or attention. And unfortunately, there are many other symptoms that can occur. The way we diagnose multiple sclerosis is by doing a physical exam, getting a good history, and then doing some tests. There are some blood tests that we can do to rule out other things. And then oftentimes, we'll do an MRI of the brain and spinal cord to look for lesions. And those lesions are areas of inflammation and damage in the myelin. There is no cure for multiple sclerosis, but there are treatments available that can help slow the progression of the disease. And there are also treatments that can help with the symptoms. So if someone has weakness, we might recommend physical therapy to help improve their strength. If someone has balance problems, we might recommend physical therapy or occupational therapy to help them with that. And there are also medications that can help reduce the frequency of the attacks as well as slow the progression of the disease. I hope this was helpful. I hope you learned something new. And if you have any questions, please leave them in the comments below.